data is analyzed to find out exactly what is the stress scoring integrates, particularly for the corporates. So as I told you, we have biological a particular session, and this is basically the digital cardiodiabetes medicine. It's a new topic. It's the future of cardiodiabetes, and I come from Bombay. I'm the founder member of Lilavati Hospital in Mumbai, and this particular presentation was given to me on the technological innovations which are extremely important in cardiodiabetes. We know that patient care is very complex, it is sensitive, and it is a high risk activity and process for all of us, and particularly in cardiology, where we have very complex cardiovascular disease. Successful healthcare delivery will definitely require effective medical technology. And so the future in the healthcare scenario is digital, which is going to create a lasting impact in the management of cardiodiabetes. So today we do angioplasties in the cath lab, which are a robotic arm where we use it. I've been working on nanotechnology, producing drug-coated balloons for diabetic patients who've got calcified and diffuse coronary artery disease. And I'm working with a company where we are using artificial intelligence for early detection of cardiovascular complications of diabetes. We are doing a study on the stress scoring in corporates who have diabetic problems. We are doing a study with an American company on remote patient monitoring for patient alert and early detection and treatment. And today in my hospital, we have coronary angiograms which are interpreted by artificial intelligence. So we are mastering the technique of artificial intelligence. So what is artificial intelligence? It's basically the use of a computer and train the computer to model intelligent behavior with minimal human intervention. I know this is more of a Western concept, and the machine and the computers are going to do the problem solving and learning like a human brain. And the machine learning will be the most exciting area for development of occupational approaches to automatically make sense of data. The advantage of the computer and the machine to treat cardiodiabetes will be that the computer will be able to retain more information, the computer will become smarter over a period of time, and the machine is not susceptible to sleep deprivation or information overload or short-term memory loss which the medical personnel can have. What are the benefits of artificial intelligence? We will have clinical decision making, so better decision, and we may be able to replace human judgment in certain areas, like many times when we do very complex interventions, particularly in diabetic patients who have multi-organ vascular disease. We need up-to-date precision in treating these patients. Yes, we will have an update medical information from the textbooks and journals which the computer will give us. The robots will be able to deliver the treatment in cardiodiabetic patients, and this is my cath lab where we have a robotic coronary interventions in diabetic patients, where we not only treat coronary artery disease with the latest abluminous and the drug-coated balloons, but we also have heart failure devices, carotid artery stenting, grafts in the aorta, and peripheral artery stenting with soluble scaffolds and drug-coated balloons for below-knee interventions. The potential challenges of artificial intelligence will be the development cost, the integration issues like ethical issues, yes, the data privacy and security, the data exchange. We will have federal and state regulations which will have to be kept in place. So what has been our work on artificial intelligence in cardiology? We have stent implants by robot. We have home monitoring devices, both for blood pressure and blood sugar. The patients have wearable sensors and mobile apps which give us significant amount of data which need to be interpreted and operationalized by physicians. The positive impact of this will be that we'll be able to predict and diagnose by algorithms which we will develop to model representation of data much faster and more efficiently than a doctor can do. For example, we have created a particular algorithm for electronic health record, which includes variables such as the international classification of disease, the billing codes, the medication prescription, the lab values, the physiological measurements, the imaging studies in the cath lab, and the encounter notes. And if you look at the discharge summary from my hospital, it is on basis of this particular kind of algorithm that we have created into a computer system. We've created a certain artificial intelligence for echocardiography, like my recent PhD whom we have employed is tracking hypertrophic cardiomyopathy and telling us whether it's physiological in relation to athletes, or it is a hypertrophic cardiomyopathy which is autosomal dominant, and which is a HOCM, which is a hypertrophic obstructive cardiomyopathy. Similarly, our department runs an AI in diabetes care, where we do a retinal screening, which is automatic with automatic recordings. We have clinical decision support, predictive population risk stratification, and patient management tools. So this is the automatic remote diabetic retinopathy screening solution with the hand-held fundoscopic cameras, which are hybrid, where you get an automatic report by the robot on the fundus, and also we have a Narayan Nrutyalaya to report, which is more manual and which comes after a few hours. So what about categorization of the AI and diabetic care? As I told you, it helps us in the handheld fundoscope, which is artificial intelligence, automatic retinal screening. Clinical decision support is basically on the detection and the monitoring of diabetes and the comorbidities, which are basically the cardiovascular comorbidities of diabetes related to heart disease, coronary artery disease, peripheral arterial disease, carotid artery disease, retinopathy, and neuropathy. And yes, with our data, we have predictive population risk stratification and patient self-management tools with AI-approved glucose sensors, artificial pancreas with the closed loop, and both the patient activity and the dietary tracking devices. So as we know that artificial intelligence and improved screening and detection of both the diabetic retinopathy and macular edema, research documents that deep learning based AI grading of diabetic retinopathy from retinal photograph is associated with a sensitivity and specificity of close to over 90%. Because AI predictive modeling will identify cardiovascular complications in diabetic populations. So a diabetologist in my hospital who doesn't have the time to look at cardiovascular morbidity and cardiovascular screening, which is the main complication of diabetic patients, has got AI on the rescue, which will detect carotid artery disease, peripheral arterial disease, retinopathy, neuropathy, a diabetic foot, and so on and so forth. And this will help prevent a lot of unnecessary emergency department visits, admissions, readmissions, and so on and so forth. So artificial intelligence will provide a practice decision support tools for physician caring for diabetic patients to prevent cardiovascular complications of diabetes. And the machine learning approaches will help doctors customize diabetes medication to optimize their adherence and health outcome. And it will also help doctors diagnose diabetes non-invasively and more accurately measure and monitor the severity of diabetic neuropathy, diabetic wounds, and cardiovascular disease. So this was a 2017 meta-analysis which suggested that diabetic management for both the patient with diabetes and their clinician is now being simplified and improved by new sensors, pumps. We have smartphone applications and other breakthrough in artificial intelligence to achieve better glucose control, reduce hypoglycemia, and improve patient satisfaction and reported outcomes. And this, I'm telling you, is not theory to me, because this is actually applicable in a hospital where we use artificial intelligence big time now to all our cardiovascular equipments, so that we can detect complications early and prevent illness, especially cardiovascular illness in diabetic patients. We also have a system of remote patient monitoring technologies for better patient outcome. And as you know, that RPM and telehealth in cardiodiabetes is the present and the future. RPM can employ a host of wireless peripheral measurement devices such as implantable biosensors, blood pressure cuffs, glucometers, and pulse oximeters, as well as sensors that collect data passively. And this helps doctors to actually store the data in the recorder systems, and it can alert patients on any arrhythmias, atrial fibrillation, heart failure, accelerated hypertension. Also for clinicians to log into the system to review the data and follow up the patients and take early actions. So this all becomes very important, patient alert. So this is the way the remote patient monitoring works, where the patient had a blood pressure cuff, they have a blood glucose, they have weight which they take and the steps, and this goes from the patient to the center, and the center alerts the doctor for any arrhythmia or any hypertensive crisis or any hypoglycemia or hyperglycemia, so that or symptoms of heart failure or atrial fibrillation, which can be detected early and treated early in terms of the remote patient monitoring. So a remote patient monitoring in the diabetes world is an emerging technology, and self-management in diabetes is heavily tied to lifestyle modification, but telehealth will allow providers to reach patients also in rural communities and provide them quality care. So tackling the diabetes with remote patient monitoring becomes important in terms of telehealth, basically to prevent complications of diabetes. Keeping this in mind, we have the Indo-Global Cardiodiabetes Academy, and I'm one of the founders of this academy. We've started a fellowship in the cardiodiabetes medicine. We may get, and mostly we will get, a Royal College of Physician affiliation. In this particular fellowship, we will have an online course, but it will be artificial intelligence enabled cardiovascular screening, and we've created heart and diabetic clinics which are artificially intelligent enabled. This is in Worli in Mumbai. It's first of its kind skilled programs in India, filling the gaps in the cardiodiabetes medicine, recognizing it as a new subspecialty. As Eugene Braunwald, when he came to the CSI conference in Mumbai, I was the organizing secretary, and Eugene Braunwald from his hospital bed said, "My dear colleague cardiologist, the future of cardiology is in cardiodiabetology." And keeping that in mind, we started this particular fellowship. Now in this particular fellowship, we've kept an added artificial intelligence enabled. So we have 3 doctors who are PhD, who are helping us in getting us information which is through the machines. The course is structured with online lessons, distant learning, hands-on training on the site, and online by live videos. And there's a mentorship with the faculty on site and web conferencing. And a very good content has been developed. As the prospectus of the FCDM course comes, I will forward it to the API West Bengal to take this forward. So this is my department, where we have digital EMR, electronic medical record. We have echoes, which are artificial intelligence enabled, and it gives you a flag whether it's an abnormal echo or a normal echo, and then we have the doctor intervention. Similarly, peripheral Dopplers, carotid Dopplers, and renal Dopplers are all AI enabled. Stress test is and wireless Holters are also enabled for 7 days by artificial intelligence. ambulatory blood pressures, pulmonary function test, most of our hemodynamic monitoring. We have a data of 5 lakh patients on our ECG machine, and we have a robot which reports the ECG. So all these are basically to reduce the work of doctors so that they can concentrate more on bigger things rather than be involved in day-to-day reporting of reports. I know it is more of a Western concept. It's not an Indian concept. In America and in the other parts of the world, there may be a lack of specialists, and therefore artificial intelligence is taking a bigger leap in the Western world, but I'm sure the same is going to happen in India too. So this is and we've started it in a hospital, so I'm sure the others will take the lead from there. These are a couple of projects which I'm doing now. One is the artificial intelligence and stress scoring, where we have a stress detection system which is based on physiological signals, hemodynamic parameters like heart rate, blood pressure, retinal scan, biochemistry including serum cortisol and norepinephrine, metabolic age, BMI, and we have a stress scoring questionnaire. And this data is analyzed to find out exactly what is the stress scoring integrates, particularly for the corporates. So as I told you, we have biological algorithms, we have perceived stress scores based on questionnaires, we have body fat analysis and iris scanner with vascular imaging, which are all done through AI, where a doctor is not involved. It's the work of the technician, and only if we find screening, say about 1,000 patients, if the score is more than 10 or around 8 or 10, then there is a counselor intervention. We're doing also a study on artificial intelligence and early detection of cardiovascular complications of diabetes, and this is for patients predicting heart failure risk by weight, hypertension, creatinine, HDL, QRS duration, and the patients with the highest score would face a 5-year high risk of heart failure. Similarly, we are doing a study with an American company called AMCs for remote patient monitoring technologies for better cardiovascular outcome and to alert patients for hyperglycemia, accelerated hypertension, heart failure, and atrial fibrillation. And there are much more that we are doing, but thank you very much for your patient hearing. I know this is not a very practical topic for this particular audience, but this is a very common topic in Mumbai, and most of the house is full when I talk on digital, because my students and the doctors are now very keen on imbibing the newer technologies, particularly artificial intelligence and remote patient monitoring, to the extent that in my hospital we have 3 PhD scientists. 2 are from Tamil Nadu and 1 is from North India, and they are purely working for my hospital in artificial intelligence in non-invasive cardiology to detect cardiovascular complications early in diabetic patients, to alert physicians through RPM, and also in the cath lab we are doing coronary angiogram interpretation through the computer by artificial intelligence, and now we will also have a robot to do PCI, where the cardiologist will be sitting in the control room on a joystick, where you can actually cannulate the coronary artery with the guiding with the robotic arm. The wire will be crossed and will be able to deploy stent. And I'm working with an American company based in Florida and Tampa, where we have innovated a balloon called the drug-coated balloon, which is based on nanotechnology, where we have encapsulated a phospholipid and a sirolimus into the capsule of the phospholipid to deploy this particular drug into the endothelium up to the adventitia to prevent restenosis, particularly in diabetic patients who have very diffuse calcified disease. Thank you very much, ladies and gentlemen, for your very, very kind attention.